Hello everybody and welcome back to another anatomy tutorial. Today we're going to be looking at the anatomy of the larynx. Now I know this is a topic that many people find difficult to conceptualize, the 3D relationship between the various different components that make up the larynx. And hopefully by the end of this talk we'll have a much better understanding of how the various structures fit within one another. We'll start by looking at this diagram that I've made and then move on to look at these structures within the CT. Now today's focus is going to be mainly on the major components of the larynx and the components that we need in order to stage laryngeal cancers. There are lots of smaller components that I will look at in another video, especially the intrinsic and extrinsic muscles of the larynx. So let's start by having a look at this cartilaginous and bony structure that make up the exterior shell of the larynx and provide the larynx with its anatomical structure. And it's these various components that we're going to be trying to look for on our CT in order to figure out where the different components are in relationship to one another. So on the left-hand side here, I've drawn a lateral view of the larynx, and at the superior aspect of this diagram, we can see a hyoid bone wrapping around this red structure. So this green structure here is the hyoid bone coming around this red structure, which is known as the epiglottis. Now the epiglottis runs from inferior to superior as well as running from anterior to posterior. So you can see the left hand side or this side of the image is the anterior portion of the patient. Here is our posterior portion and our epiglottis slants posteriorly like that. Wrapping around the epiglottis in this semicircle or C shape, this incomplete ring of cartilage around the epiglottis is what's known as our thyroid cartilage. We've got these large left and right lamina of the thyroid that come and form this laryngeal notch at the front of our thyroid. Posteriorly, we've got these superior horns, both a left and a right superior horn, and inferiorly, we've got these inferior horns that articulate with this cartilage below here, which is known as the cricoid cartilage. Now, the cricoid cartilage is a complete ring and it gets much thicker posteriorly. And as we head out anteriorly, that band or that anterior arch of the cricoid cartilage becomes much thinner. And people describe this as a signet ring-shaped structure here. And it's one of the only rings of cartilage within this upper respiratory tract that make a complete ring all the way around. Not shown here is our thyrohyoid membrane that I've got on this other image, which connects the hyoid bone to our thyroid cartilage. You can think of that hyoid bone as holding up all these structures. There's membranes connecting each and every one of these components. So the top of our larynx is that hyoid bone, and the bottom of our larynx is this cricoid bone from which everything stacks on top of it. Between our cricoid and our thyroid cartilages, we've got this cricothyroid membrane, and that's if we were to make an emergency airway, that's the membrane that we would need to cut through. Now, if we rotate this image round and we look posteriorly, we look in at that angle to this image, this is what we will see here. Now you can see I've cut off the hyoid bone here and cut off this section of thyroid cartilage in order to be able to see into the main area of our larynx. Again, our hyoid bone wraps around and we can see this thyrohyoid membrane between the thyroid cartilage and the hyoid bone. Our epiglottis has this leaf shape and the stalk of the epiglottis heads down towards our thyroid cartilage and attaches here. The epiglottis will fold backwards as we swallow. It will go in this direction and cover these structures that we see here. We can see our cricoid cartilage making a complete ring all the way around, thicker at the back than it is at the front. And on top of those cricoid cartilages, which we couldn't see on this image, are our arytenoid cartilages. And these are really important structures when we're looking at the vocal cords. The arytenoids are paired cartilaginous structures, and there's a cricoarytenoid joint here. There's actually articulation between that cricoid cartilage and that arytenoid cartilage. We can see coming from the arytenoids, there's a vocal process of the arytenoids, and then this vocal ligament that heads from the arytenoid cartilage all the way to the anterior surface here of our thyroid cartilage. And these ligaments are the structures that run within our true vocal cords. We're going to look a lot more closely at these vocal cords, especially on the imaging. And lastly, to note on these diagrams are our tracheal cartilaginous rings. We've got our tracheal rings that head down the trachea. Below our cricoid cartilage is the beginning of our trachea. And you can see that they don't make complete rings all the way around the trachea. And this is actually where the esophagus runs posteriorly to the trachea. And this incomplete ring allows for a food bolus to travel down here unobstructed by those cartilaginous rings. So let's move on. This is the image that we have seen now, that we've examined. And there's some soft tissue that drapes between these arytenoid cartilages and the epiglottis itself. So I've cut away this section of diagram here, and I've overlaid this soft tissue, or this mucosal membrane that wraps from the arytenoids heading up all the way to the epiglottis. So this fold of soft tissue that drapes between the superior process of the arytenoid and the epiglottis is known as our aryepiglottic fold. Our aryepiglottic fold then sends down this mucosal membrane that heads all the way down to our vocal cords. And within this fold of mucosal soft tissue is our quadrangular membrane that also heads down towards those vocal cords. Now, what's important to appreciate here, and quite difficult to illustrate, but we're going to see much better on our CT scans, is that this fold of mucosal tissue that heads down towards our vocal cords folds inwards before reaching these true vocal cords here. It folds inwards on itself, makes a space that we can't see in this image, and then heads out again to make these vocal cords. So this first fold of tissue coming around like this is what's known as our false vocal cords. That fold of tissue comes right the way around, makes a space between this false vocal cord and the true vocal cord, known as our laryngeal ventricle. Our laryngeal ventricle then folds round and comes and makes our true vocal cords, which has our vocal ligament running within that fold of tissue. Now, it might be quite difficult to see on this diagram, but I want you to realize that that false vocal cord comes in, makes a laryngeal ventricle, and then comes out to make our true vocal cords. There's actually a space between these two pieces of tissue. When we look especially at our coronal images, we're going to see that laryngeal ventricle. It's a really important landmark when staging laryngeal cancers. Now, lastly, I want to look down the larynx like this. We're going to be looking inferiorly at the vocal cords. So let's move to that view. We're now looking down like that. And this is what we'll see when we pass an endoscope into the patient, when we're trying to place an endotracheal tube, which is going to have to come between these vocal cords. Anteriorly here is the base of our tongue. That is where you slide the blade of the endoscope down and lift forward, and lifting that tongue forward will lift this epiglottis here anteriorly as well, because the base of the tongue and the epiglottis has a fold that connects them. This is our median glossoepiglottic fold, and we're going to see that really nicely on our images. On either side of that median glossoepiglottic fold, we have these spaces here known as vallecula. So the blade of our endoscope is going to come in here, that median glossoepiglottic fold. As we apply pressure anteriorly, will lift this epiglottis away from the vocal cords. We can see posteriorly here our cricoid cartilage with our arytenoid cartilages lying on top of the cricoid cartilage. And we can see our true vocal cords coming towards this anterior commissure here, the angle of the anterior part of our vocal cords. Now, those arytenoids can rotate internally to close the vocal cords or rotate externally to open the vocal cords. Open vocal cords are going to allow us to breathe. Slightly closed vocal cords will allow us to phonate or to speak. The vibration of those vocal cords is going to create sound, and then closing of those vocal cords will prevent fluid from coming into the trachea and actually head down into the esophagus rather. We can see this tissue here, which is our false vocal cords, and in between this dark false vocal cords and this light true vocal cords will be our laryngeal ventricles. What I haven't drawn here is the connection between the superior process of our arytenoids and our epiglottis like this, which is our aryepiglottic fold coming across like that. Posterior to this, we've got large sinuses known as our piriform sinuses, which form part of the hypopharynx. If you can imagine this epiglottis folding downwards like this, the primary function of that epiglottis is to divert food and fluid away from this larynx and into our esophagus. Now, the epiglottis doesn't actually provide a watertight seal. It's our vocal cords coming together that provide a watertight seal, but our epiglottis is curved and it allows for deflection of the food and liquid away from this laryngeal complex. Now, all of these structures constrict together to form a closing of that larynx, and we're going to look at that first on a barium swallow, identify these various structures, and then move on to our CT scan. So let's start by looking at this lateral radiograph. We are now going through a basic sequence of a barium swallow. Get our orientation here, we can see the mandible here. We can see the patient has a mouth full of contrast, our hard palate coming across, soft palate coming down, separating our nasopharynx from our oropharynx. And then we can see our hyoid bone here below the mandible. Posterior to that hyoid bone is our epiglottis coming up like this, and that space in front of the epiglottis, between the epiglottis and the base of the tongue, are our vallecula here. We can see our piriform sinuses behind our larynx that will eventually head towards our esophagus. Then we can see our trachea anterior to that esophagus. We can actually see the true vocal cords, our laryngeal ventricle here, and our false vocal cords lying below this epiglottis. Now, as the patient swallows, I want to show you what those laryngeal structures do when we swallow. And you can actually do this on yourself by holding your tracheal cartilage and swallowing. You'll feel all those structures rise and then fall. And that's what's going to happen on this patient. Let's start by looking at the hyoid bone. As the patient swallows, you see that hyoid bone lifting up. Now that thyrohyoid membrane means that the thyroid cartilage is going to lift up, and as that thyroid cartilage lifts up, our epiglottis lowers down. So let's look at our epiglottis here. As we swallow, that epiglottis goes from being upright to going more shallow and then completely shut like that. You can see how our epiglottis has gone on top of those vocal cords. And this fluid now is having to track posteriorly into our esophagus. None of that fluid is coming into the larynx. Similarly, you can see our vocal cords here lifting up, up, and shutting. So we completely shut that trachea off from our digestive tract. You can also see how the soft palate rests against that posterior pharynx, which prevents fluid from coming up through our nose as well. And then we can follow that liquid all the way down. Now, as we've shut all these structures, once we've swallowed the liquid and we open those structures up again, those structures will be lined now by some of this barium contrast, and that helps us to identify those structures more easily on the radiograph. So we follow them swallowing all the way, and we can finish with this picture here. You can see the contrast on top of the tongue running down to the base of the tongue and pooling within the vallecula here. You can see our hyoid bone running across and our epiglottis coming up like this. We can actually see that aryepiglottic fold here extending from the epiglottis all the way down towards the arytenoids. And again here we can see our piriform sinuses, which have been layered by some of that contrast, and then our esophagus heading off down posteriorly. There's no contrast on the vocal cords because our epiglottis have covered those vocal cords when we did the swallow. So now let's move on to our CT scan and identify some of the anatomy there. We'll start by having a look at the lateral CT scan, which will mimic that lateral x-ray that we've just taken. So here we are, we can see our hard palate, our soft palate, our nasopharynx above, our oropharynx heading down towards our larynx here. You can see the clivus and our sella turcica and our sphenoid sinuses, all structures that we've covered in previous talks. And then we can look more closely at the larynx itself. Let's start by looking at the hyoid bone, which is anterior to our epiglottis here. We can follow that hyoid bone all the way around. You see how it wraps around that epiglottis all the way around on both sides. As we go back to the midline now, we can see our epiglottis with our vallecula, those spaces anteriorly to the epiglottis and the base of our tongue here. And we can just see that median glossoepiglottic fold attaching the base of the tongue to the epiglottis here. The epiglottis has a free edge and it extends all the way down to its root where it attaches to the thyroid cartilage here. Now, anterior to that epiglottis, we can see a really useful landmark which is known as our pre-epiglottic fat. You can see that the density here is fat density. If we were to look at our subcutaneous fat here, it's the same density as this that we're seeing here. This is our pre-epiglottic fat. The epiglottis then heads down to our thyroid cartilage, and I've actually chosen this image because the cartilages in this patient have become a little bit ossified and makes it more easy to identify them on a CT. So we can see our thyroid cartilage wrapping around here all the way down with our superior and our inferior horns, coming down to the anterior portion with our laryngeal notch of the thyroid, the Adam's apple that you can feel on the male. Below that thyroid is our large posterior portion of our cricoid and our anterior portion of our cricoid. There's our cricothyroid membrane between the two. You can see above the cricoid, we should be able to find our arytenoids. If I go slightly laterally, we can see our arytenoids there with our cricoarytenoid joint there. Our arytenoids will give off our true vocal cord across the larynx, as well as superiorly giving off this aryepiglottic fold that we see heading down here. If we head then to the midline, we can see our true vocal cord as well as our false vocal cord, that fold of tissue down separated from the true vocal cord by this laryngeal ventricle. So let's have a look at what that looks like on an axial CT. We can start off in the nasopharynx, head our way down. We see the uvula here coming down, and keep scrolling down until we see the tip of the epiglottis. So there's the tip of the epiglottis coming into view. We can see our median glossoepiglottic fold here, joining the epiglottis to the base of the tongue. Laterally to this fold are our left and our right vallecula. That's where the blade of our endoscope will go down and lift that epiglottis away. Posteriorly, we can see these piriform sinuses that don't form part of the larynx. They actually head down into the hypopharynx. So as we head back up, let's look at this epiglottis coming down. We should see our aryepiglottic folds now come into view. We're scrolling inferiorly on the patient. This is that tissue that heads from the arytenoids to our epiglottis, our aryepiglottic folds. Our aryepiglottic folds then should come down towards the arytenoids. Here are our arytenoids. Let's head slightly superiorly and try and find those false vocal cords. You can see anteriorly that fat density in our pre-epiglottic space, our aryepiglottic folds here, and as we come down, we can see that fat density coming out laterally here, and this is a sign that our folds here are our false vocal cords. If we were to scroll down slightly inferiorly, we should then come into those laryngeal ventricles below those false vocal cords. So let me scroll down slowly one slice here. Here are our false vocal cords, starting to see the openings of our laryngeal ventricles. Let's go one down. Here we are now in the space of our laryngeal ventricles, this widening of that gap. We can see our cricoarytenoid joint here, which is an indicator that we're heading to the level of the true vocal cords. Let's go one further down and we should see our true vocal cords coming into frame here with a sharper anterior commissure here. This is not the hyoid bone. This is in fact the thyroid cartilage. It's just been ossified in this patient. We can see our cricoid bone posteriorly and then these true vocal cords with the vocal ligament within them. Now we know that this is a true vocal cords because we've passed that cricoarytenoid joint, as well as we've lost that fat density around these cords. So we're at the level now of the true vocal cords. As we scroll down further, we should see that complete cricoid ring forming like that, and now we are in the trachea. You can see posteriorly to the trachea is our esophagus, and our tracheal rings don't make a full complete ring, allowing for a food bolus to pass unobstructed by those tracheal rings. Lastly, we can look at our coronals. Some people find this quite difficult to understand, and we're really lucky here because our cartilages are so ossified. We can see our hyoid bone that's wrapping around our epiglottis. Here's the tip of our epiglottis. That epiglottis heading now down towards our thyroid and cricoid cartilages, and this is our aryepiglottic fold, that piece of tissue that's coming down. Our piriform sinuses can be seen laterally here. And this aryepiglottic fold is going to come down, and this fold of tissue here is going to form our false vocal cords. You can see that fat density surrounding those false vocal cords. Then we have our laryngeal ventricles coming out like that before getting to our true vocal cords here. No fat signal on either side of those true vocal cords. We can see our cricoid cartilage there articulating with those inferior horns of our thyroid cartilage. And this is the kind of goblet-shaped cup that you'll see here. From the bottom of our cricoid, that now becomes trachea. That is no longer larynx. Now, in order to stage laryngeal cancers, we need to know the boundaries of our larynx. So we separate the larynx into three separate sections: our supraglottic section, our glottic section, and our subglottic section. And it's really easy to do. Our supraglottic section runs from the tip of the epiglottis here all the way down to the superior surface of our true vocal cords. So from this region of the epiglottis all the way down, we find our true vocal cords. Anything above that superior surface is known as supraepiglottic. our laryngeal ventricles, our false vocal cords, our aryepiglottic folds, our epiglottis, the thyroid cartilage, all of that is in our supraglottic region. Our glottic region is made up solely of our true vocal cords. Anything from the superior border to the inferior border of our true cords is known as the glottic region. Our subglottic region is from that inferior border of our true vocal cords all the way down to the inferior border of our cricoid cartilage here. So this is where our larynx ends and our trachea begins. So you can see that in order to understand the structure or the anatomy of the larynx, there actually aren't that many big components that we need to know. But if we can identify the hyoid bone, the epiglottis, the thyroid cartilage, our arytenoid cartilages, and our cricoid cartilage, as well as those aryepiglottic folds and our false and true vocal cords, we've come a long way in identifying the various structures within the larynx. Now, if we were to see a mass within the larynx that's extending throughout the larynx, we can then subdivide the larynx into those three separate sections, our supraglottic, our glottic, and our subglottic section, in order to describe the origin and the extent of that mass or cancer or laryngocele that is growing within the larynx. So I hope that's helped you understand the various structures within the larynx. We haven't covered the blood supply, the nerve supply, and the different muscles that surround the larynx. I'm going to leave that for another video because this then starts becoming extremely complicated. I want you to understand the broad brushstrokes approach to the larynx. So if you like this style of video where we go through some medical diagrams and then we actually go through clinical images identifying the various different pieces of anatomy, please consider subscribing to the channel, liking the video, and signing up to my newsletter. I send out a newsletter once a month sharing some of the resources that I've been enjoying. I share with you various cases, I share with you the odd meme or two, as well as sharing with you some of the tips that I have for writing your Part 1 Anatomy and Physics courses. The link to that monthly video will be down below. Otherwise, I'll see you all in the next video. Goodbye, everybody.